Thank you for joining Cancer Support Community Atlanta for Frankly Speaking about Making Treatment Decisions. Facilitated by Bryan Miller, Director of Psychosocial Support Services with Atlanta Cancer Care. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website and complete a new attendee form to stay connected to all future programs. Welcome everyone to Frankly Speaking about Making Treatment Decisions. I'm Katie Armsby, the Program Outreach Director with Cancer Support Community Atlanta. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website, cscatlanta.org, where you can see all the free oncology support services offered virtually. As I said earlier, everyone will remain muted. Throughout the presentation, we invite you to enter questions into the program chat box, which Bryan will address at the end of the program during the Q&A. I want to welcome our presenter today. Bryan Miller received a Master of Social Work degree from Florida State University. He's a licensed clinical social worker and board certified in oncology social work. He is the Director of Psychosocial Support Services at Atlanta Cancer Care and the Assistant Director of the Atlanta Cancer Care Foundation. Bryan is a member of the Association of Oncology Social Work, the Georgia Social Work Oncology Group, and the American Psychosocial Oncology Society. So welcome, Bryan, and I'll go ahead and pass it off to you.
All right, well, thank you for that introduction, Katie, and good morning and welcome to all of you who are choosing to participate in this workshop today. I'm absolutely thrilled for this opportunity to talk about the incredibly important and dynamic process that all people living with cancer and their loved ones face, and that's making treatment decisions. Before we begin, though, I will share that Dr. Thomas LeBlanc medically reviewed the original slide deck earlier this year. And then as a workshop disclosure, this program was developed by the cancer support community and it's generously supported by Pfizer Oncology. I have no financial relationships or affiliations to disclose, and I'm not being paid by Pfizer Oncology. We really have an expansive topic today, and my goal is to provide an overview of the treatment planning basics, setting goals, some considerations in choosing the treatment team, the role of guidelines and pathways, and treatment options, and some aspects for caregiving. And at the end of the workshop, I hope there'll be time for some questions and answers. I do think that context for the information that will be reviewed today is important. So as you read these objectives, I would like to take a moment to point out that we may have participants who were recently diagnosed with cancer and many aspects of cancer care are unfamiliar because it's unlike anything they've faced before. Whereas there may be others who've been undergoing cancer treatment for months or even years already. And there are many factors that may impact treatment options and goals of cares and decision-making, and individual circumstances can vary. When someone finds out that they or their loved one has cancer or that it's come back, it can bring up a wide range of feelings, and some more intense than others, and for the future to seem uncertain. And without question, cancer is life-altering, and what you're going through will always be a part of you. But it doesn't mean that cancer has to define you. No one can tell you what your experience means for you or how you should identify yourself. That's up to you. So at this pivotal time, I think the proverb, knowledge is power, rings so true in cancer care. Learning all you can about your cancer and the treatment options can help you feel more in control and make decisions that are best for you. And you don't have to do it alone. In fact, it's highly encouraged to get support. Identify the people in your life that you can talk to and lean on for support and practical assistance. And find out about the type of support services that may be offered for you or your loved ones where you receive your care. And ask about local and national organizations that provide support services and resources too, and connect with other people who are undergoing or have gone through treatment before or are caregivers, whether it's through a support group or one-on-one peer match. And I do want to say that hope is so important because it can help people endure some of the most hardest moments. And by creating a sense of hope in your life, it can help you face cancer with courage to deal with the new and ongoing challenges, and yet still create space that allows for times of happiness and meaning. But of course, what you hope for may change over time, and there's no right or wrong path to finding hope. Your care team can help you make treatment choices that can build confidence and hope for the future. Loved ones, friends, or coworkers and members of your faith community can also bring hope to your situation. And sharing your story and learning about the challenges and joys from others who are living with cancer can also be important sources of hope. And of course, many people find hope through spirituality, religion, or philosophy. In a report called the Patient Values Initiative, The Many Voices of Value, It's from a nonprofit organization called Cancer Care. It found common themes that emerged from conversations between patients and oncology social workers. It found that many patients don't feel that they're active participants in developing their cancer treatment plans, and discussions about treatment planning are often overwhelming for people who are newly diagnosed. And a few people realize they can ask questions, and even fewer know what questions to ask during these discussions. And patients want their providers to recognize and appreciate the effect treatment has on their lives, and that patients' priorities and perceptions about their treatment can change over time. Bottom line, the decisions you and your care team make about your treatment should reflect your medical condition, your personal situation, and your goals. And of course, cancer treatment can be impacted by age and your overall health, if you have chronic health conditions like heart disease or diabetes. And there's a number of non-medical factors that also need to be considered. Issues like your family life, whether you're working full-time or part-time, or if you need to continue working while going through treatment. And logistical factors, how far is the physician's office or hospital from where you live? How often will you have to go there? And are you able to drive yourself? Is there a caretaker or family member that can take time off of work to assist you? Do you have health insurance? And can you afford the care and medicines that have been recommended? And there are other important factors that can influence your medical care, like religious or cultural beliefs, values, and preferences. So having nuanced conversations with your healthcare team about your values, beliefs, and preferences can lay the foundation for person-centered, family-focused, and culturally sensitive treatment planning. And to me, an empowerment approach is a process through which people gain greater control over decisions and actions affecting their health. This is the time to think about what's most important to you and what your personal goals are, and finding a strategy to meet those goals. And I think it's also a time to seek out resources that can help you understand, cope, and manage living with cancer, whether it's emotional, psychological, social, spiritual, physical, or financial. And as I've already mentioned, you don't have to do this alone. Ask for help. Ask your care team to connect you with information, other professionals, and organizations that can help you achieve this. And take action. Work with your care team to identify any health-promoting lifestyle changes that you could make to best promote physical and emotional quality of life, like weight management, a healthy diet, regular exercise, stress management training, and smoking cessation, to name just a few. With shared decision-making, I will have to say that cancer care is not a one-size-fits-all. You really, to have a personalized treatment plan, you have to engage both patients and caregivers in the decision-making, which again is I call shared decision-making. And that's a process where decisions about your care are not made for you, but rather with you. And it's relationship-based because it involves doctors and other members of your care team, and it deliberately considers both the best scientific evidence available as well as your values and preferences to make those decisions together. And it really involves sharing information back and forth, and it's an ongoing process. But I will point out, not all patients want to know how sick they are or how long they may have to live or to be involved in decision-making. Some people prefer to have someone else that they designate to make decisions on their behalf. And of course, norms vary across cultures regarding the role of autonomy or family involvement in information seeking and decision-making. Let your doctor and care team know your preferences up front. And when you talk to your doctor about treatment options, ask about the goals of the treatment and see how each treatment option might affect the goals that you have for your life or the life of your loved one. Knowing what's important in your life can help you decide on the medical care that's right for you. For example, if you are of childbearing years, treatment can affect your fertility and your ability to have children. If you think you want children in the future, ask your doctor how cancer and cancer treatments will change your fertility and sexual health, and what steps you may take to help preserve it before starting treatment. And for some people, if a previous treatment stopped working, a decision to pursue another treatment regimen or clinical trial may fit with a goal to have as much time as possible with family, friends, or beloved pet, whereas for someone else, pursuing a less aggressive treatment may have fewer side effects, and that may be important to them to maintain quality of life over length of life. And with family and social relationships, there may be an upcoming special event or milestone that's important to you, like attending a wedding or a graduation. And some people may assume that they have to give up these plans to strictly adhere to a treatment schedule. But the key is to have an open dialogue with your care team, because it may be possible with planning that a specific procedure or infusion could be postponed or changed so that you feel well enough and your immune system is strong enough for you to do what's important for you and your family. And if you are someone who wants or needs to continue working during treatment, Find out what options there may be with scheduling treatment that fits with your work schedule, like early morning radiation appointments, chemotherapy infusion scheduled towards the end of the week so you have the weekend to recuperate, and see if your employer has any workplace accommodations like telecommuting. But I think it's also very important to ask your doctor how treatment may affect the type of work that you do. For example, if you're a musician that plays a stringed instrument or a hairstylist that has to use scissors throughout the day, what if part of that recommended treatment regimen could cause a side effect of peripheral neuropathy, which is a set of symptoms caused by damage to the nerves that control sensations and movements of our arms, legs, hands, and feet. With chemotherapy-induced peripheral neuropathy, those side effects can last for weeks, months, or even years. After treatment's done, would you still want to pursue it or see what other options are available? And that seems like maybe an obvious answer, but really it's nuanced because our decisions are really value-based on potential risks, benefits, and different trade-offs that are specific to each person. And as you're setting your goals, also consider what activities in your community are most important to you. And have you thought about how you can remain active and involved in your community? And what about meeting your spiritual and emotional needs now and as you or your loved one goes through treatment? What else is important to you? What has your own experience been with serious illness? And do you remember seeing someone close to you who is sick or dying? Think about what went well, what didn't go well, and why. And if you were in their situation, what would you want for yourself? And what would you want to avoid if possible? How does this affect the goals that you set? But along those lines, I do want to add, please don't assume that the treatment, side effects, or outcome that a grandparent, parent, or someone else you know will be your experience. Individual health circumstances vary from person to person. And in the 20 plus years that I've worked in healthcare, I've seen such advancements in cancer care, including available treatments that are available and very sophisticated ways to manage side effects. As we continue to sift through the dynamic process of decision-making, I think it's important for you to also understand your values, because the type of cancer, its stage, and treatments that are available certainly are part of what determines your options, but there's a number of cancer treatments that are preference sensitive, meaning a person's values and goals really determines the optimal choice at important decision junctures. Basically stated, among the treatments available, doctors can't determine the correct or optimal choice solely as a matter of medical science. Available options can have different trade-offs, including risks, benefits, side effects, and costs. For example, while it is clear that a person who has a ruptured appendix must have immediate surgery, or that someone with bacterial pneumonia must receive antibiotics, it's not clear whether a 55-year-old man with a localized, slow-growing prostate cancer should have treatment right away to remove or destroy that cancer instead of taking a more conservative monitoring approach called active surveillance. Because the difference in the expected survival or other serious health outcomes between these available options is actually small enough that there are other considerations to put on the table. Choosing to remove or destroy that prostate cancer can lead to complications such as incontinence or sexual dysfunction, while choosing active surveillance can cause anxiety about not treating the condition and inconvenience associated with regular testing and a higher risk of disease progression. So in this situation, individual patients and those close to them place different values on these outcomes and can therefore have different assessments of the balance of benefits and harms associated with those options. Another example of preference-sensitive decisions is with breast cancer, particularly when there's a choice between having a lumpectomy with radiation or a mastectomy. With both options, survival is the same, and neither surgical choice affects that a person will need chemotherapy, hormone therapy, or HER2-targeted therapy. And although I think a majority of women, if they have a choice, will choose the less invasive breast-conserving surgery option, there still are a number of personal factors that influence these treatment choices, such as the impact on body image and sexuality when there's permanent loss of breasts, worry about a somewhat higher risk of the cancer returning within the breast after lumpectomy, time and travel required for radiation therapy, post-surgery side effects, and recuperation time for a mastectomy and breast reconstruction. Making treatment decisions about your cancer may seem like a very complicated problem at times, but you can break the process down into smaller bites, one step at a time, and locate yourself in the process. Think about your goals, your values, your life, and your current situation, and work with your doctor to create a written treatment plan. And a treatment plan is kind of like a roadmap because it helps to lay out the expected course of care. And sometimes it also indicates who's responsible for that portion of your care. But not all treatment centers use written treatment plans. If your center doesn't, you can still ask, though, for as much information in writing as possible, and also see if they have any pre-printed documents that you can use to collect and write the information down for yourself. That way, you and your caregiver can refer to them if a problem comes up when you're at home or while traveling. An important part is to really understand your diagnosis in order to make a good choice for treatment options. So when you talk to your doctor, ask for the diagnosis to be explained and for it to be written down for you. And what I'm about to share next is really the most basic yet most important point from this workshop. If you don't fully understand something, please say something. Make your doctor and other care team members aware and ask for clarification or for it to be explained in a different way. Because at times, care team members may use medical terms that may be unfamiliar, or they may not explain how parts of our body work, or use hard to interpret numbers or complex graphs. And you can ask them to explain information in what we call plain language, because people need information they can understand and use in order to make the best decisions for their health. And if you want to make sure that you and your doctor understand each other about the information that was provided, consider saying something like, "What I'm hearing is," and then share the information in your own words as you understand it, followed by, "Is that right?" And that way your doctor can confirm whether you're both on the same page or if some of the information needs to be clarified. Other potential barriers that may not be as obvious, but absolutely are important to address, are communication barriers. Approximately 20% of the US population speaks a language other than English in the home, and there are millions of people who have vision, hearing, or speech disabilities, what we call communication disabilities, and they use different ways to communicate effectively. So if you do not speak English or you are limited English proficient, please know that your healthcare facility will provide you with a qualified medical interpreter, but your care team may not realize that you need or want one unless you tell them. Likewise, if you have a communication disability, auxiliary aids and services should be utilized, and your care team can assist with this. And I also want to add that more than 90 million adults in the US have poor reading and writing skills. If you're unable to read or have difficulty reading, please let your care team know. You're not alone, and sharing this truth will benefit you and help your care team provide information at the right level and in the right format for you. A few other points on this slide. Ask for a copy of your pathology report. Copies of any pathology reports are very important to keep, as your diagnosis and treatment are often based on them. And understanding the report will help you and your medical provider better understand your condition. And talk to people who've had cancer, especially those with similar diagnosis. You can learn about their experience and what it was like going through specific procedures or treatments, and it may help give you ideas about questions you should ask your care team about. And these are just 5 basic questions that you can use to ask about your cancer diagnosis. Choosing your doctor and treatment center clearly will be one of the most important decisions that you make. And there are a number of excellent cancer centers in the United States and Georgia, but how do you know where to look? The doctor who found your cancer is usually the first person that you'll ask for a recommendation for an oncologist or treatment facility. And you may have family members or friends that have gone through treatment who may make recommendations as well. But I think some people actually tackle finding a hospital or cancer center first and then look for an oncologist who practices there. So it's important to find a hospital or community cancer center, in my opinion, that has experience treating your type of cancer. So for example, larger hospitals or cancer care networks with affiliated practice locations may have more experience with different kinds of cancers and offer more services specifically for cancer patients. If you live in a small town or a rural area, you may need to travel to a larger city for some or all of your cancer care. You can go online to find out if nearby hospitals or treatment centers are accredited. And accreditation is important because it validates that a facility such as a hospital or outpatient clinic or a specific program within a facility has met or exceeded a set of quality and care standards set by the accrediting body of experts. One such example is the Commission on Cancer. A good way to judge the quality of the cancer offered at a treatment center is to find out if they've been accredited by the Commission on Cancer of the American College of Surgeons. This accreditation really verifies that a cancer program provides comprehensive quality care and challenges them to enhance the care that they provide by addressing patient-centered needs and measuring the quality of care that they deliver against national standards. There's approximately 1,500 cancer centers across the US that are accredited by this program. Another organization that accredits is the Joint Commission. It's a nonprofit organization, and they have an online quality check that gives you information about the quality and safety of the organizations that they accredit. And you should also see if the hospital is approved as a National Cancer Institute Cancer Center, either as a cancer center, a comprehensive cancer center, or a community oncology research program. Because the NCI really supports research-oriented institutions across the US that are known for their scientific excellence. And these are just 3 of the accreditation programs that are out there. There are others too that you may find when you're looking up information about facilities. So you've looked at and chosen a facility. What about the physician? As I said before, find a physician that specializes in the type of cancer that you have or treats a large number of patients with your type of cancer can help you really receive the best care. And depending on your treatment plan, you may need a medical oncologist, a surgical oncologist, and a radiation oncologist. But as you're looking for different providers, again, talk to your family and friends and see what their experience was like if they've gone through treatment for cancer, and ask what doctors that they would recommend. And if there are some names that come up, you can then look to see what the doctor's credentials are. Find out whether they have any advanced training. Confirm if they're board certified in oncology, meaning that they passed a high-level examination. And then if you are interviewing to find a physician, find out how long they've been in practice. How many patients with your type of cancer do they treat each year? And if it's a rare cancer or special treatments or surgeries, it really, again, could be very important to find doctors with that specific related experience. For example, a Whipple procedure is one of the most complex involved surgeries used to treat tumors and other disorders of the pancreas, intestines, and bile duct. And when considering surgery success rates and complications, you want to be at the place where the surgeon does a high volume of these surgeries. And the other thing I would recommend doing is finding out if the doctor that you are looking to establish care with is participating in your insurance plan. And you can either do that by contacting their office and talking with their staff, or many plans allow their members to look up providers by name or specialty. And if you are contacting an office to check about whether they participate with insurance, see if they have a financial counselor or advocate, financial advocate, that could give you an idea of what your cost in or out of network would be to have care there, and if that hospital or clinic offers any financial assistance, and if they do, how you can apply for it. And I'd also want to make sure that the doctor you're looking for has access to clinical trials. And I would want to know, what support services do they offer? Do they have oncology social workers or counselors, navigators, or registered dietitians? And aside from these factors and finding your team and putting it together, I would also look at the characteristics of that provider. Different providers have different communication styles and approaches to care. Some people really prefer somebody who has a blunt, business-like approach to medical care, whereas others prefer a more nurturing environment. And there can be a lot of different health professionals who will be a part of your care team. And I'm not going to go through these to provide definitions for each of them, but I will share one. When you go to your cancer care center, find out who is part of your team and ask specifically what the roles are so you know when and how to access them. You can also go to the National Cancer Institute's website at www.cancer.gov, and use their online search feature to look up some of these care team member names, where they'll give you a definition, medical terms, plus a wealth of other excellent educational materials. Advance. So, research indicates that the average patient asks 5 or fewer questions during a 15-minute doctor visit. And to me, that's so surprising because people ask more questions when buying a cell phone. And there can be a number of reasons why this occurs. Obviously, appointments can be very stressful and emotional, and sometimes people freeze up or they forget what they were going to ask, or they may be reluctant because they feel it's impolite to ask a medical expert a question, or they get the sense that the doctor is in a hurry. But to me, the truth is that asking questions of your doctor and care team is key to good communication and your overall care. So prepare for your visits. Keep a notepad with you so you can write down questions as you think of them, and bring that pad of paper to the appointment so you can be sure to get answers to each of them. But I also want to point out that studies show that cancer patients forget substantial amounts of information that's provided by their healthcare providers. Again, can be due to multiple reasons, but this also reinforces the importance of writing down answers and the usefulness of having a family member or friend take part in your appointments, not only to provide support, but for help in remembering what's said. But I do know that in this time of COVID-19, that it may not be possible for them to physically accompany you to appointments, but they could still participate via phone or video conference call. And honestly, sometimes it can be most useful to actually record important information using your smartphone during appointments. But I'd say only do that if you have your provider's permission. And I think you also need to talk to your providers about any medications that you're taking, including over-the-counter medications, vitamins, or supplements. And this actually may be more important than you realize, and I'll cover that in just a little bit on another slide. Today there's such a focus on developing evidence-based standards of cancer care. So it's important for people to know that guidelines and pathways exist, and they may help make informed treatment recommendations. These tools really are useful in setting standards of care, assuring consistency, and providing measures of quality. Guidelines are usually developed by professionals, professional organizations using panels of experts that include specialists in that cancer type, as well as experts in psychosocial care or symptom management, and often patients too. And oncology providers really rely heavily on the National Comprehensive Cancer Network Clinical Practice Guidelines in Oncology and the American Society of Clinical Oncology Clinical Practice Guidelines for Treatment Guidance. And the recommendations are based on what's known to work best, and they're not influenced by the cost of any drug or therapy, nor is their development supported by any pharmaceutical or insurance company. However, insurance companies often use these guidelines to make their own decisions about what to pay for in cancer care. Oncology clinical pathways have been part of a growing trend for providers and payers. And pathways provide specific treatment recommendations for different types of cancer, and they're developed by expert panels. But they differ from guidelines in that they're produced by insurance companies, for-profit companies, or oncology practices. And actually, pathways really look to balance the various aspects of care, including clinical efficacy, safety, toxicities, cost, and scientific advances. And in some instances, oncologists receive incentives for adhering to these pathways. So you have a right to ask your doctor if he or she is using guidelines or pathways to manage your care. And you can also ask who develops the guidelines or pathways and whether there's any cost factors or incentives involved. Many cancer treatments and options exist today, which is great. And depending on your particular situation, you may receive one treatment or you may receive a combination of treatments. And cancer treatments can be used as a primary treatment, adjuvant therapy, or neoadjuvant therapy, which I'll explain. So the goal of primary treatment is to completely remove the cancer from your body or kill all the cancer cells. Any cancer treatment can be used as the primary treatment, but the most common primary cancer treatment for most common cancer types is actually surgery. And the goal of adjuvant therapy is to kill any cancer cells that remain after the primary treatment in order to reduce the chance that the cancer will recur. Again, any cancer treatment can be used in adjuvant therapy. Neoadjuvant therapy is similar, but treatments are used before the primary treatment in order to make the primary treatment easier or more effective. For example, in some treatments with chemotherapy, HER2 targeted therapy, or hormone therapy may be given before breast surgery. And I'm just going to briefly provide an overview for each of these type of treatment options. So of course, chemotherapy is a treatment that involves the use of drugs to destroy cancer cells, and it can be given through different forms, whether it's IV, pill, or injection, or applied directly to the tumor. And it's called systemic therapy because it travels throughout the bloodstream and reaches and affects cells all over the body. And chemotherapy drug combinations will vary both in dose and frequency. Radiation is actually one of the most common treatments for cancer, and it uses high energy particles or waves such as X-rays, gamma rays, electron beams, or protons to destroy or damage cancer cells. And there are two main types of radiation therapy: external radiation therapy, which is also called external beam radiation therapy, which uses machines to direct those high energy rays from outside the body into a tumor. And it's done on outpatient visits and usually given over many weeks. This is actually the most common type of radiation therapy that's used. And then there's also internal radiation therapy, which is also called brachytherapy. And it refers to a radioactive implant that's put inside the body in or near the tumor. Of course, your radiation oncologist would talk with you about what is best for your particular situation and why. As I mentioned, surgical care is one of the most crucial aspects of cancer treatment, and there's several types of surgery that can be helpful for people with cancer. Diagnostic surgery is used to remove a tissue sample for testing and evaluation. Staging surgery works to uncover the extent of cancer or the extent of the disease in the body. An example of this would be laparoscopy, which is a viewing tube with a lens or camera that's inserted through a small incision to examine inside the body and to remove tissue samples. With treatment surgery, it removes the cancerous tumor or growth from the body, whereas debulking surgery removes only a portion, though not all of the cancerous tumor. And with reconstruction or restorative surgeries, this is often used as follow-up to curative or other surgeries to change or restore a person's appearance to the function of a body. Immunotherapy. This is really an innovative cancer treatment that uses certain components of a patient's immune system to fight his or her cancer. And it can be done by stimulating that person's immune system to target cancer cells or by introducing man-made immune system proteins and other elements into the body. Immunotherapies are usually administered via IV into a vein. And immunotherapy can also be used along with chemotherapy. And what's called precision medicine, which is information about genetic changes in your tumor, can help decide which treatment will work best for you. Targeted therapy is actually the foundation of precision medicine. Targeted therapies are drugs or other substances that block the growth and spread of cancer by interfering with specific genes and proteins or molecular targets that are involved in the growth, progression, and spread of the cancer. So if there is a targeted drug or other treatment approved for your type of cancer, you'll likely be tested to see if the genetic change targeted by that treatment is present. And since genetic changes that can drive cancer may occur over time, you might also have your cancer tested if it comes back or gets worse. And if you're interested in learning more about precision medicine, the cancer support community will actually be offering a virtual workshop on this topic in August. Hormones are chemicals that are naturally produced by organs that make up the body's endocrine system. And researchers have found that some cancers are actually fueled by hormones and may depend on them to grow. So hormone therapy is most often used to treat prostate and breast cancers that use hormones to grow. And it falls into these two broad categories, those that block the abilities to produce hormones and those that interfere with how hormones behave in the body. And hormone therapy can be given in different ways, such as pills that you swallow, injection under the skin or in the muscle, or surgical intervention like removal of ovaries in women or testicles in men. Hormone therapy is most often used along with other cancer treatments. Stem cell transplant. This is a specific treatment that may be used for certain types of cancer, such as leukemia, multiple myeloma, lymphoma, and other blood and immune system diseases that affect the bone marrow. And stem cell transplant is a procedure in which a patient receives healthy stem cells to replace damaged stem cells. So before the transplant, the patient receives high doses of chemotherapy and sometimes radiation therapy to prepare the body for transplantation. And this is what we call a conditioning treatment. After the stem cell, they're infused into the patient's bloodstream, they travel to the bone marrow, and they can begin the process of forming new healthy blood cells. And this process is called engraftment. And there are two main types of stem cell transplants. One is autologous transplant, which uses a person's own stem cells. So these cells are removed, treated, and then returned to their body after a conditioning treatment. And then there's also allogeneic transplant, which uses cells from a donor. And that donor might be a family member, or it might be someone who's not related. Something I haven't listed here, but I'll just mention, is syngeneic transplant, which is much less common, and it's rare for the simple fact that it's only used on identical twins. In addition, that donor twin must have identical genetic makeup and tissue type. Clinical trials. These are research studies that involve people, and through clinical trials, doctors can determine whether new treatments are safe and effective and work better than current treatments. And researchers design clinical trials to test new ways to treat cancer, to find and diagnose cancer, prevent cancer, manage symptoms of cancer, as well as side effects from treatment. In terms of treating cancer, sometimes these are new treatments that are being studied for the first time, or it may be a treatment that's already been approved for a certain type of cancer and tests are now being done on a different type of cancer. Or some clinical trials might be testing new combinations of treatment. And there are different reasons for participating in clinical trials. Some people may participate because there are no standard treatments available for them, or because treatments they've tried already haven't worked. And other people will participate due to altruistic reasons. They want to advance medical knowledge or make a difference in the care of future patients. But I will say most people have some concerns about taking part in clinical trial because they're not really sure what it will mean for them. So to me, taking the time to get as much information as you need before you decide is really the best way to be sure that it's the right choice for you. Palliative care. This is also referred to as supportive care, and it's a specialized medical care for people living with this serious illness. And this type of care is not focused on treating the cancer, it's focused on providing relief from symptoms such as pain, depression, shortness of breath, fatigue, constipation, nausea, loss of appetite, difficulty sleeping, anxiety, and the stress of illness. And the goal really is to improve overall quality of life, both for the patient and family. Primary palliative care is actually provided on a regular basis by oncologists in their care team. But there are specially trained interdisciplinary teams of doctors, advanced practice providers, nurses, social workers, and chaplains who have dedicated expertise in palliative care, and they work together with the patient's other doctors to provide an extra layer of support. And this resource may be provided on an inpatient unit or outpatient program, or in some cases in a patient's home setting. And an oncologist may choose to refer somebody early on in their treatment for palliative care, particularly if they have a cancer that has a high symptom burden. I do want to point out, though, that palliative care is not the same as hospice care. Both palliative care and hospice care provide relief of symptoms and comfort, but palliative care is appropriate at any age and at any stage in a serious illness, and it can be provided along with treatment that has a curative intent. Whereas hospice care begins after treatment if the disease is stopped, and the individual must have a life expectancy of 6 months or less if the disease runs its natural course. So I will just share that there's not really enough time to take a deep dive on this topic, but I added it because there's so many common uses of this, and people have differing beliefs and misinformation, which in turn can impact treatment decisions and outcomes. So before I show the graphic that goes with this, I just want to clarify the terminology and make a few points. Conventional medicine really is a system in which medical doctors and other health professionals treat symptoms and diseases using drugs, radiation, or surgery. And conventional medicine is also called biomedicine or allopathic, Western, mainstream, orthodox, or regular medicine. So if a non-mainstream practice is used in place of conventional medicine, then it's considered alternative. One example would be using a special diet to try to treat cancer instead of using anti-cancer drugs that are prescribed by an oncologist. Conversely, if a non-mainstream practice is used together with conventional medicine, then it's called complementary. Some common complementary health approaches may include practices like deep breathing, yoga, tai chi, massage, meditation, guided imagery, or involve special diets and use of natural products like herbs, vitamins, minerals, and probiotics, which are often sold as dietary supplements. In cancer care, complementary approaches often are used to help cope with the symptoms and side effects. Integrative healthcare, which is also referred to as integrative medicine, often brings conventional and certain complementary approaches together that have been shown to be safe and effective. So this is what I want to show you. In a national survey that was commissioned by the American Society of Clinical Oncology, and it involved over 4,800 adults in the US, it found that 4 out of 10 Americans believe that cancer could be cured solely with alternative therapies. And this is so concerning because there is no question that evidence-based cancer is necessary to effectively treat disease, and research clearly shows that patients who use alternative therapies instead of standard cancer treatments have much higher mortality rates. And we know that delaying surgery, radiation, or chemotherapy, or other traditional treatments that use unproven alternative therapy can really allow the cancer to grow and spread to other parts of the body. The other point here that I want to make is that natural does not equal safe. There are a number of reasons why your oncologist may recommend that you avoid certain dietary supplements. Even though there may be ads or claims that a natural product has been used for years, they don't prove that it's safe or effective, or that it won't interfere with your cancer treatment or interact with other medications for that matter. And some complementary or alternative therapies have been reported to cause serious health problems or even death. So my takeaway message is this: please tell your doctor if you're considering using any alternative or complementary approaches, including any dietary supplements, no matter how safe you think they are. Having an open and honest conversation with your healthcare provider can really help you understand potential benefits, risks, and side effects, and ultimately help you make an informed decision. And you may also want to ask your provider for a referral to a registered dietitian for nutritional counseling, which can help address concerns about getting essential nutrients and maintaining a healthy body weight, both during and after treatment for cancer. If you would like to learn more on this topic, including information about dietary supplements, I encourage you to visit these 3 websites: the National Center for Complementary and Integrative Health Clearinghouse, NCI's Office of Cancer Complementary and Alternative Medicine, and the National Institutes of Health Office of Dietary Supplements. very reliable. So making a decision, I want to go over a few factors here with you to consider and discuss with your doctor. One, I think everybody needs to know what the goal of their treatment is. Is it curative or is it palliative? Curative meaning that treatment's intended to completely get rid of the cancer, or palliative meaning the treatment can't cure the cancer. If it's palliative, then the goal might be to control the cancer, meaning shrink your cancer or slow the growth of your cancer, which can lead to longer survival. Or the goal may be comfort, to improve symptoms or delay the onset of symptoms. And really understanding what the potential benefits of treatment may be, the good things that could happen from the treatment, or the risks, which are the bad things that could happen from treatment, including the types and severity of side effects, and if there's late effects of cancer treatment or long-term effects, and the reasons behind the treatment choice for the recommendation, as well as the cost. So when details about your cancer are known, your doctor will talk with you about different treatment options. And sometimes other members of your care team, such as nurses or pharmacists and others, will be involved in talking with you and teaching you about treatment. And these are just some of the questions that you may want to ask about options given to you. And these, of course, are additional questions that you may want to consider asking as well. And as you look over them, I will just mention that your care team may use decision aids to help during the treatment decision-making process. And what decision aids are is the evidence-based educational tools, and examples would be educational literature with graphics, photographs, and diagrams, as well as decision grids, videos, or interactive website-based programs. Getting a second opinion can really help a lot of people feel more sure about their diagnosis and their treatment plan. And when you're facing cancer treatment, it's normal to wonder, could somebody else offer more information or a different treatment option? And you might want to find another doctor just to have them look at your results and talk to you about your personal situation and maybe give you a different take on it. But there's other reasons that people may want to get a second opinion. One of those reasons would be if you have a rare or unusual cancer, or if your doctor tells you that they're uncertain about the type or stage of your cancer, an unknown primary. And you may want to get a second opinion if your doctor is not a specialist in the type of cancer that you have, or if your doctor gives you multiple treatment options and you're having difficulty deciding among them, or if you just want peace of mind, that just hearing from a second person that yes, that's the option that they would offer as well. But I want to bring up second opinions just because I think treatment decisions should only be made after you've learned all you can about your diagnosis, prognosis, and the options available. And it can take time, particularly depending on the type of cancer that you have. In some cancers, you have to make decisions right away just because of the severity of it. But oftentimes, people can take their time to be able to go and meet with other people to gather information. And the other thing I want to point out here is that some people find it hard to tell their doctors that they'd like a second opinion, but remember, it's actually common for patients to get a second opinion, and doctors are comfortable with the request. But if you're unsure of how to bring up the conversation, you may just want to pose it this way. I'm thinking of getting a second opinion. Can you recommend someone? Or before we start treatment, I'd like to get a second opinion. Will you help me with that? Or if you had my type of cancer, who would you see for a second opinion? Or I think I'd like to talk to another doctor to be sure I have all of my bases covered. And if you do get a second opinion or seek one, make sure to check with your insurance company about its rules on second opinions and if there'd be any different out-of-pocket cost if that doctor is in or out of network with your particular plan. And of course, as you go through treatment, if side effects are a problem, be sure to track and report them so they can be managed. And if your cancer care team isn't asking about side effects, speak up and tell them. If what's offered to manage side effects isn't helping, tell your doctor so something else can be tried to manage it. And ask about what can be done to manage the symptoms and side effects that are affecting you the most, and be specific how they're interfering with your daily life. And I will point out here that an outpatient palliative care program may not be readily available where you live. So in some circumstances, the oncologist may coordinate services with other specialists or programs, like a pain management specialist. Unfortunately, sometimes treatment does not work well or it stops working. And if this happens, your doctor may say that your cancer has progressed and there may or may not be other treatment options. But when you've had many treatment options and they're no longer controlling cancer, it may be time to reweigh the benefits and risks of continuing to try new treatments. And I do want to point out that when options are posed to people, I just want them to feel empowered and know that they always have the right to accept or refuse any treatment offered. But in doing so, your care team will want to ensure that you understand the nature of the treatment proposed and the consequences of not having it. And to me, the power of language and the words we use here are incredibly important. So electing not to proceed with an aggressive treatment that may only extend life for a short period, may not improve overall quality of life, is not the same as giving up or doing nothing. Instead, this is where the goals of the interventions and plan change to supportive care, which may involve hospice at that point. And the focus becomes treating the symptoms and helping the person feel as good as possible for as long as possible. But before you stop or start treatment, I want you to think about the benefits and drawbacks, and to ask yourself if you're feeling unwell from the side effects of the treatment or the advancing disease or emotional overload, because some of those things may be able to be treated. And talk with others, particularly your doctor and those close to you. Their input and support may help clarify your thoughts, and be open with your loved ones about your cancer and the news you've been given, along with the decisions you've made or thinking of making. And for caregivers, I know having a loved one end cancer treatment can be so hard, and it's such a difficult decision to accept. It's okay to ask your loved one how they came to their decision and to make sure that you've explored all of their options. Your loved one's decision might make you feel frustrated or sad or even trigger anticipatory grief. All of these feelings are normal, and acceptance may take time. And if you need support, discuss this with the care team. I'm going to go over a few common tools that are so important for all adults. As long as you're able to make and express your own decisions, you can accept or refuse any medical treatment. But if you become seriously ill, you could lose that ability to participate in decisions about your care. And just want to share this example. A 2017 Kaiser Family Foundation survey found that 97% of people say it's important to put their wishes in writing, but less than 40% have actually done it. And because of accidents or illness, 3 out of 4 people will be unable to make some or all of their own medical decisions at some time in their life. And that may just be temporary, but again, that's pretty significant. So advance directives are incredibly valuable tools to help adults communicate their wishes about future medical care if they're unconscious or if they're too ill to communicate. And advanced care planning includes getting information on the types of life-sustaining treatment that are available, deciding and documenting what types of treatment you would or would not want should you be diagnosed with a life-limiting illness or be in a state of permanent unconsciousness, and sharing your personal values and preferences with your loved ones. In Georgia, the term living will was replaced with Georgia Advanced Directive for Healthcare back when the laws changed in July of 2007. And advanced directives also allow you to appoint a person to make healthcare decisions if you're not able to speak for yourself. And again, in Georgia, this is called a healthcare agent. In other states, it may be called a healthcare power of attorney. So your healthcare agent can speak for you if you become temporarily incapacitated, like due to an accident, or if you become incapacitated due to irreversible disease or injury. And you don't need an attorney to draw up these documents, and there's no cost to complete them as well. You can do that on your own. And the point here I want to make is that without advanced directives, those making decisions for you might not be the ones you would choose, or they may not make the choices that you would prefer. Cardiopulmonary resuscitation is an emergency procedure that in many situations can help save a person's life if their breathing or heart stop. And it originally was created, or intended, I should say, for situations where death was accidental, such as drowning or electrical shock, or when an otherwise healthy person experiences a sudden cardiac arrest. But today in hospitals and nursing homes, CPR has become the standard on all patients who experience heart or breathing problems, or failures, I should say, unless they have a physician order for non-resuscitation. And under Georgia law, a person who would be a candidate for non-resuscitation, or DNR, is someone who, based on their physician's determination, has a medical condition that can reasonably be expected to result in imminent death if they're in a non-cognitive state with no reasonable possibility of regaining cognitive functions, or if it would prove to be medically futile. So I bring this up because, to me, if you are hospitalized or if you're in a nursing home, if you're asked a simple question, do you want CPR? That's not adequate for making an informed decision, especially for people who are in very poor health or have a terminal illness. Information about what's involved with CPR when it's administered, the potential risks of CPR that are specific to that person's individual medical situation, including the probability of long-term survival or their ability to recover, really should be part of that conversation. Another important document listed on the slide that could be useful for any adult is a financial power of attorney. And that's a legal document that you can use to give someone else the authority to take specific actions on your behalf, such as signing your name or signing checks to pay bills or to sell a piece of real estate. And if that power of attorney is durable, it means that it remains valid and in effect if you become incapacitated. If it's not durable, then it ends if you become incapacitated. And then there's also a legal will, which is a legal document that states your wishes regarding the distribution of your assets and the care of any minor-aged children in the absence of another parent. So if you die without a will, those wishes may not be carried out, and your heirs may be forced to spend additional time, money, emotional energy to settle your affairs after you're gone. A free tool that I absolutely love is the Prepare program. The website and question guide walks people step by step through questions about what's most important in life using video stories and other mechanisms to help them choose a medical decision maker, decide what matters most to them, how to tell their choices about their medical wishes to others, and how to ask doctors the right questions. And the answers that you come up by using this tool can help inform the choices you make in advance directive. And I'll also just note that this Prepare question guide is also available in Spanish. Other advanced care planning resources that you may want to explore is Caring Info, which is a program of the National Hospice and Palliative Care Organization. And it provides free resources, really, to help people make decisions about end-of-life care. And you can access state-specific advanced directives with instructions and other documents that may be helpful for starting conversations. And the Georgia Department of Human Services Division of Aging, you can actually download the Advanced Directive for Healthcare from this website and get information on Georgia's law concerning cardiopulmonary resuscitation. And then I have added the State Bar of Georgia because they offer an online directory where you can search to find a lawyer near you who practices the type of law that you need. And if your household is low income, you might qualify for free civil legal services. You know, a quote that I like, and it rings so true to me, from a book on caregiving by Rosalind Carter called Helping Yourself, Help Others, a book for caregivers, is there are only 4 kinds of people in this world: those who have been caregivers, those who currently are caregivers, and those who will be caregivers, and those who will need caregivers. So the caregiver role may be new to you, and it may seem scary or overwhelming at times, but try to keep in mind that caring for someone with cancer is really about the relationship that you share together, and that this relationship is going to have to expand in new ways as you learn to manage the stress of cancer that has come into your life. And it may be helpful to talk with your loved one to understand how he or she would like you to be involved with care and how they would like you to assist with communication and decision making. And it is easy to feel that everything about cancer is an emergency and that you have to make treatment decisions quickly. However, you usually have time to slow down, think about your loved one's goals and priorities, and talk with others. So take time, ask questions, think through next steps, and partner with the care team to develop a treatment plan for and with your loved one. And again, I can't emphasize enough to take notes for yourself and your loved ones. That way you can compare notes after each appointment to discuss what each other heard and understood, because you may interpret things differently or you might miss something. And I also want to acknowledge that there can be unique challenges if you're serving as a long-distance caregiver, which is often used to describe anyone who provides some sort of support at a distance from the person needing care. But you can still be involved in care even if you can't be there. You can talk with them to help them weigh the pros and cons of each treatment. And you can also help them think through reasonable short and long-term expectations. And I also want to acknowledge that being a caregiver can be so tough. Many caregivers feel a loss of personal time over the course of their loved one's illness. So keep in mind that while you're taking on new and additional responsibilities, you are still allowed a life of your own. And you will need your friends and community to give you support as you support your loved one. Make time to care for yourself and ask for help when you need it. And I did want to share this slide as well, because I think the internet can be a friend or a foe. Because unfortunately, not everything on the web is accurate or reliable, and some sites are actually so inaccurate that they can be downright dangerous. So for help in separating fact from fiction and good information from misinformation, the National Cancer Institute's Evaluating Online Sources of Health Information page has some excellent questions to ask. One question here, and I will put that up in a moment. who is publishing the information, and who paid or sponsored it. You can find that information usually in the About Us or Disclaimer section. And is the original source identified? Is it a research study or from a medical journal? And who reviewed that information before it was posted? A tip would be look for credentials. Is it a physician, a PhD? And how current is the information? And when was it last reviewed? And here is just an example of cancer information sites that you can trust. And I will just point out the NCCN website at the bottom. It contains guidelines for patients and quick guide sheets. And basically these step-by-step guides really share information on latest advances in cancer care, and they feature questions to ask your doctors. They provide patient-friendly illustrations, glossaries, terms, and acronyms. And the other thing to do here is to ask your care team where you can find credible, honest, factual information, and really help them help you gather information about the options that you've been given. And if you've already started searching on your own, bring that information with you and ask if it's correct or if you should trust it. And the other points on the slide are just benefit from the experience of others, but remember, your path is unique. And lastly, choose a doctor that you can trust and you feel comfortable openly communicating with. And then I wanted to share a few of these resources before we go to Q&A. And this is from the Cancer Support Community's headquarters. I just want you to be aware that they offer a cancer support helpline that's staffed by licensed professional counselors. And you can see the hours that are posted here. There is also, of course, the Cancer Experience Registry, which I'll get to at the next slide. But I did want to point out that they also offer Open to Options, which is a decision support counseling program that can help you prepare for an appointment where you'll have to make a treatment decision. And you can access that by calling the helpline. Services are available in different languages. And they also offer an option online called Open to Options, Let's Talk About Treatment Options. And it's an interactive tutorial that you can use to help build a personalized question list. And of course, Cancer Support Community offers the Frankly Speaking About Cancer. They're available as Cancer Ed online educational videos, ebooks, and through programs like today that are live. So the Cancer Experience Registry that I had skipped over may be something that you would be interested in participating in. It's really a unique online community that brings people together to make their voices heard, to connect with others and share experiences. And it was launched back in 2013. And the registry now has, I just received an email on it yesterday, over 14,700 participants, both patients and caregivers. So anybody impacted by cancer at any stage can participate, and it's free and it's confidential. And if you want to join these simple steps, just go to the cancerexperienceregistry.org website. And of course, the Cancer Support Community also offers a grassroots movement program where you can have your voice heard at local and national levels to policymakers and stay up to date and learn more about key issues that are important to people living with cancer. And the website is listed at the bottom of the slide. Something I would highly encourage that you at least check out is called mylifeline.org. This is a place where you can create your own private website to receive social, emotional, and practical support from friends and family throughout the treatment process and beyond. And My Lifeline actually includes discussion boards that lets you connect with others. And these boards are actually moderated by licensed mental health professionals and are available 24/7. And of course, we have our own fantastic Cancer Support Community Atlanta, which offers free virtual oncology support services like gentle yoga, monthly nutrition seminars, different support groups, and education programs like these. And you can access them at cscatlanta.org. And that will bring us to our question and discussion.
Thank you, Bryan. I think you brought up so many important things to consider when weighing different treatment options. So thank you so much for that presentation. As we jump to the question and discussion portion of the program, I do want to remind everyone that today's event has a program evaluation, and the link for that evaluation has been entered into today's chat box. So we're going to go ahead and jump to some questions that have been submitted. And the first question is, I'm concerned my cancer treatment could affect my ability to have children. Who within my healthcare team is it best to discuss this with, as I'd like it to be taken into consideration before beginning treatment?
Thank you. So members of your care team, like an oncology social worker or nurse, may be able to guide you where to find credible reproductive information and resources, like Livestrong Fertility Program. But it really is your oncologist that you need to talk directly with to learn how cancer treatment could affect your fertility and really estimate the risk of being either temporarily or permanently infertile. And I'd actually encourage you to start this conversation early, actually earlier the better, because it'll give you more time to consider fertility preservation options. And you may need to be referred to a reproductive endocrinologist, which, it's a mouthful. An endocrinologist is somebody that is an expert in fertility and infertility, and they're actually trained in assistive reproductive technologies.
Okay, thank you. And the next question we have is, I'm interested in exploring some alternative treatment options, but I'm afraid to bring this up to my healthcare team. Do you have any suggestions on how to start this conversation?
Yeah, I'm actually so glad that you're considering bringing this important topic up with your care team before you make any final decisions. If a patient's interested in another treatment option, most doctors want to know about it so they can provide help and advice, and actually to ensure that it's at least an informed decision. So what my suggestion would be is for you to devote some time and effort to prepare for the conversation, to actually get that pad of paper out that I talked about earlier, and actually create a list and start with that list of the reasons you're actually interested in exploring alternative treatments. Is it due to side effects or a hope that your cancer can be put into remission or something else? And if you've done any homework and any specific alternative therapies, add that information to that list. What are the claims made about the treatment? And be specific. Actually, I think the more specific you can be is the better. And also, if you know what type of treatment that it would be given in and who is actually administering the treatment. Is it a licensed physician? And I'd say take that list of questions, information in your notes to appointment if possible. And when you start your visit with that provider, maybe give them a heads up that you've got a topic and some related questions that you want to discuss before leaving that day. And then when the opportunity comes up, I think you could pose it in a way that really shows that you know your doctor wants what's best for you. So maybe just saying something like, I appreciate all that you and your healthcare team have been doing to treat my cancer, and I value your opinion, so I'd like to run something by you before I make a decision. And if you need more help in preparing for a conversation, again, seek out somebody at your treatment center that you trust, whether it's a nurse or a social worker, and they may be able to help you craft some more questions or ways to start the conversation.
Those are some great points. Thank you. And I think the next question goes back to a slide you had earlier in the presentation. I'm sure a difficult decision for so many people. Can you discuss the pros and cons of participating in clinical trials?
I can share a few. First, just as with any treatment, clinical trials do have a number of pros or cons that you may want to consider, as does, again, any treatment. But I wanted to start with saying that all treatments that are used every day to treat cancer had to go through clinical trials before being approved by the Food and Drug Administration. So by participating in a clinical trial, you may gain access to new interventions that are not otherwise available. And if that new intervention proves to be better than the standard of care, then you'd be among the first to benefit from it. And you may also increase the total number of treatment options that are available to you, even if you haven't gone through all the standard treatment options yet. And some people really like having more personalized, frequent checkups and conversations. And being in a clinical trial often includes that. But again, I think there are some reasons that people don't want to participate in clinical trials. And one of the obvious is just in terms of effectiveness and side effects. New treatments are being studied and they're not always better than or even as good as standard of care. And people may fear the unknown and the potential loss of choice from being in a study. So for example, if you're joining a study that includes randomization, you won't get to choose which arm of the study you're in, whether it's the investigational drug or treatment that they're offering or the standard treatment, because you'll be randomly assigned. And if it's actually blinded, you won't know which treatments you're receiving. And of course, some people may see it as an inconvenience to have to go for more office visits or testing or the time or travel involved. But I will say, I think people may be willing to accept at least a certain amount of risk for a chance of being helped. Of course, they need to be realistic about that chance. And I just, again, encourage people to really mull over this tough decision with people on their healthcare team and clinical trial coordinators, just to get as much information as possible.
Thank you, Bryan. You mentioned so many good points and things to consider. This next question is kind of a timely one. I'm nervous that receiving chemotherapy at the clinic will make me more susceptible to catching COVID-19. How can I cope with this fear?
That's again, I have to just say, I'm glad you asked this question. I think COVID-19 has certainly added another layer of anxiety for people living with and being treated for cancer. But I also think there are certain things that people can do to cope with that fear and not let it get in the way of getting the care that they need. I think first step would be just acknowledging your feelings. This is a stressful time. Give yourself permission to feel how you feel, but then also talk to your care team, knowing the facts about COVID and what steps you can take to protect yourself and what precautions your treatment facility is taking to ensure your safety or the safety of others really can help manage anxiety. I know at the facility I work at, staff and patients are being screened both before entering the clinic. They're all required to wear a face mask. We're following social distancing, both in the waiting areas and infusion room. We have people doing frequent cleaning of high-touch surfaces, hand sanitizers available. And again, we're restricting the number of people that can enter the facility. So there are, again, knowing that can really, I think, sometimes help balance the amount of anxiety that we have about accessing the care that we need. But then I'd also just say other basic things, taking breaks from watching or reading or listening to news about COVID-19 is important, because I think exposure just to that news just escalates anxiety. And I can't honestly think of any other time to make self-care more of a priority than now. Learn and use practices that can help manage symptoms of stress or anxiety. I would say there's so many good apps out there like Headspace or Calm, or even the virtual programs that are offered by Cancer Support Community that can be useful in self-care. And connecting with other people. Talk to people about your concerns and how you're feeling. But I guess the last thing I'll say on this is just if fear or anxiety really is interfering with your everyday life, it may be time to seek support from a mental health professional. And the good thing is with COVID, many professionals are now offering telemental health, so you wouldn't have to actually go there in person to access that support.
I think that's such a good point to talk to your healthcare team and know ahead of time what kind of precautionary measures they're taking. And maybe that conversation hopefully will help alleviate some fears. And the next question is another one related to COVID-19. It's been difficult having to attend appointments alone due to COVID-19 restrictions. Any suggestions on how to make this easier?
Yeah, it's so tough for people to not have a family member or friend or a support person with them for their appointment or their treatments. But I think in this situation, really focusing on what we can control, no matter how small, can actually make a difference. Think of ways that they can still remain involved. Can that caregiver or family member at least drive them to that appointment? Can they participate in preparing questions that will be asked during the visit or follow-up visits? And of course, during visits with the provider, still queuing them in either by phone or video conference call may help them feel a part of that. But then I also think, if you've got for example, a 4-hour infusion coming up, plan for how you can fill that time and in the absence of somebody being there with you. Would you bring a book or a puzzle? Would you use a laptop to connect with people using social media or by phone for comfort? And if those things are not working, or if you're just concerned or having difficulty during the treatment, ask to talk to somebody, talk to your nurse, ask to talk to an oncology social worker. I think those are the basic things that I would suggest.
I think that's such a good point to anticipate the time alone and sort of already prepare and plan how you may fill it. So as we close out today's program, I want to thank Bryan so much for sharing your time and expertise with us today. I want to again invite everyone to visit Cancer Support Community Atlanta at cscatlanta.org, where you can see all the free oncology support services offered virtually. And as we wrap up, I want to invite you, Bryan, to share any closing remarks you may have.
Just that this has been an absolute pleasure, and I'm grateful to have had an opportunity to connect with each of you today. And I just wish you and your loved ones the best on your cancer journey.
Great. Thank you so much again, Bryan, and thank you everyone for joining us. We hope to see you again soon. Take care. Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org. Or follow us on Facebook. We'll be sharing additional information on upcoming programs.